Hi, I'm Keith Lonergan. I'm one of the orthopedic surgeons with Steadman Hawkins Clinic of the Carolinas and GHS. I specialize in shoulder surgery. I'd like to talk to you today about rotator cuff disease of the shoulder. The rotator cuff is a group of tendons that provides stability as well as power to the shoulder. There's actually 4 tendons that make up the rotator cuff. There's one in the front of the shoulder, and I can show you on this model. There's one on the back of the shoulder, and there's 2 that are primarily on top of the shoulder. Those tendons can provide the power to bring the shoulder and arm up in the forward direction, out to the side, and of course in rotation. The rotator cuff tendons, however, can and will get torn at times. You can present to the office with continued pain around the shoulder joint, in particular with elevation of the arm, with rotation of the arm, and with activities of daily living. When the tendons are torn, they unfortunately don't have the ability to repair themselves. The tendon is actually pulled off the bone and is unable to repair itself back to the bone. What can occur after the torn tendon can be a series of events that can continue to cause pain as well as weakness. As the tendon is torn, there can be some inflammatory reaction around that area that we sometimes refer to as bursitis. There also can be the development of bony projections in and around the rotator cuff that can cause pinching of the rotator cuff tendons as well as tearing of the tendons themselves. After a detailed history and physical exam in the office, as well as an x-ray of the shoulder, if we feel as though there's a probability or a likelihood of a rotator cuff tear, it's most likely that we are going to obtain an MRI. An MRI exam is a special radiological imaging study that can look directly at the tendons of the rotator cuff. It also provides more information about the ligaments and cartilage around the shoulder. The MRI is very specific and sensitive for picking up problems with the rotator cuff. And if there is a complete tear of the rotator cuff, we oftentimes will at least discuss the option of getting that fixed. When the tendon is torn, as I mentioned, it does not have the ability to repair itself. And unfortunately, over time, a small tear can progress to a larger tear, and even at times, over a year or so, can progress to a point that the tendon is irreparable. The development of arthritis can then progress after having a large rotator cuff tear for a period of time. So we try to recommend fixing a smaller tear before the problem gets worse. Fortunately, with shoulder arthroscopy, which is using a small camera to go into the shoulder joint and through smaller other incisions around the shoulder, we can do an arthroscopic rotator cuff repair, or through the scope. Some surgeons, and certainly in the past, a larger incision has been made over the shoulder in order to gain access to the tendons of the rotator cuff in order to repair them back to the bone. Fortunately, with advanced techniques in surgery, in arthroscopy, we have the ability to repair the vast majority of these tendons arthroscopically. The arthroscope is a small instrument that can go into the shoulder joint. It's attached to a camera that's projected onto the screen or a monitor, and we can watch the monitor as we develop our techniques within the shoulder. When we see a rotator cuff tear, we prepare the bone for the placement of the tendon back onto its original position. When we prepare the bone, we make sure that we have a nice spot in order for that tendon to heal back to the bone. In order to secure the tendon back to the bone, we utilize a device such as this, which is called a suture anchor. It is a small plastic screw that can go into the bone and has some suture that comes up out of the device, and we can use to repair the tendons back to the bone. It's a very small implant that provides very good structure and security to the tendon with very heavy stitches and suture. After we repair the rotator cuff, depending upon how large the tear was and the quality of the tendon, we oftentimes will put the patient into a sling and provide them with a protocol for physical therapy. The physical therapy component to rotator cuff repair is very important. We want to maintain the motion of the shoulder while at the same time not doing so much motion that it could potentially jeopardize the repair site. The repair process takes up to 3 months to be solid to the bone, but certainly during the first several months we can move the shoulder in certain planes to provide the motion that we need. Once the shoulder is shown that it has provided enough motion and there's been ample enough time for the rotator cuff tendons to heal to the bone, then we can progress to normal activities of daily living, such as getting back to playing sports as well as any other hobbies that you may have. If you feel as though you're getting weakness around the shoulder, pain with overhead activity, and any kind of mechanical popping or clicking, this may indicate a problem with the rotator cuff. If you'd like to give us a call, we'd be happy to evaluate your shoulder and determine whether or not you have a rotator cuff problem. Once again, thank you very much for your attention, and please don't hesitate to give us a phone call.